Hi, everybody, and welcome to tonight's virtual town hall as we answer your coronavirus questions. We started doing this last week, and the questions just keep coming in, and so we want to continue to try to get you as many answers as possible. We're doing that this half hour. Good evening to you. I'm Michael Wooten.
And I'm Mary Alice Demler. Now, we do want to let you know that we're standing by right now for the daily update from the White House Coronavirus Task Force. You are looking live at the briefing room right there. Now, when the president or the vice president comes to the podium, we will immediately bring you that live here on Channel 2. So, Michael, talk fast. Exactly.
Let's get right into our first question here tonight. And this is really one that we have gotten a lot over the past week or two. So a viewer said to us, quote, "A doctor on CTV has just said that if you're experiencing symptoms and suspect COVID-19, do not take Motrin, Advil, or other ibuprofens. Take Tylenol, acetaminophen only. It seems the Advil types may be causing a reaction with the virus that worsens it. Good advice, pass it on."
I heard this question too from another source, Michael, and while some doctors were initially concerned about this, top public health experts say that there really is no evidence to prove that ibuprofen is not safe. And here's one of our medical experts weighing in.
So there was a statement out of Europe that ibuprofen could make you worse if you get coronavirus. So far, Dr. Fauci, the WHO have said that has not been proven to be the case as of now, so it is okay to take ibuprofen.
There you go. But if you're still concerned about this, it's really worth talking it over with your own doctor. I think that should be everybody's default, Michael, right? Yeah. Depending on your own condition, any sensitivities you might have.
Absolutely. And it's one of those things that we all have to remind ourselves that we are so early on in understanding this virus, the experts, that there's going to be some of this where there's just uncertainty.
That's absolutely right. So if in doubt, go to your own doctor and get knowledgeable expert feedback from them.
Yeah. Let's get to another of really one of the most frequently asked questions or statements, really. So people are claiming on social media and elsewhere that this is being overblown. And it is in this context. A viewer texted us saying more people die from the flu each year, so I don't understand why we are shutting down the world for this. So this is kind of something that you're seeing out there. What is the reality when it comes to the flu versus the coronavirus? Watch this.
Let me tell you a little bit about this virus. So it's a brand new virus, which means none of us have immunity to it, unlike the flu. The second reason, it's about 10 to 20 times as deadly as the flu. So it kills a lot more people. The third reason, it gets more people into the hospital than the flu in terms of percentages. And the final reason, it spreads twice as fast as the flu. So because of all of those reasons, the fact that it's now in the United States, it's spreading faster, it's more deadly, and it puts more people in the hospital. Even though today the number of people that it's killed is less than the flu, if it continues like this in a few weeks, the curves will cross, and very quickly we'll see that this virus has taken many more lives than the flu.
There you have it. Michael, I'm going to do an uncomfortable disclosure here. I was one of the early deniers. As journalists, we're kind of trained skeptics, but I have to tell you, as soon as I started to look at trusted sources for the data, did some really reliable research, not only does it prove everything the doctor just said, but also we have these real life examples of what has happened in Italy, what we've seen happen in South Korea and China. So anyone who's holding out, trying to say this is much ado about nothing, is so terribly wrong.
Yeah, you understand some of the skepticism early on when the numbers in this country were what they were. But now we're seeing just this explosion of confirmed cases. It changes everything.
You've got it. Well, let's move on because we have a viewer who asked us also today, I'm wondering if they are actually still going through with the census. Now, does it make sense for them to do so when it seems as though they're just going to have to do another one in a year or two once this virus pandemic is over? Makes sense? So here's the latest information that we have about the census. Last week, the Bureau decided to suspend all field operations for 2 weeks, so that won't continue until at least April 1st, and that, of course, could get extended as well. Now, the way this would normally work is that census takers would eventually start visiting households that haven't responded online, by phone, or through the Postal Service.
Yeah, and it's that in-person aspect that's being pushed off for now. But keep in mind, the website is still operational, the phone lines still work, and so you should still be looking for the census packet that will arrive in the mail. And luckily, you can do all of this without having any person-to-person contact. That aspect of it will happen later.
Absolutely. Well, for a couple of weeks now, we've been getting daily questions about the virus's survivability on different surfaces. Okay, everybody rightfully is obsessed with this. We've addressed this before, but let's answer this question from a viewer who asked, why do we keep seeing different answers about how long the coronavirus can live on surfaces? How long is the best guess? Well, everybody, the reason you're seeing different answers is because the virus reacts differently to different types of surfaces, whether it's wood or metal or something else.
Yeah, so many factors go into all of this. Today we put together this response and we got some help from Emory University's infectious disease expert, Dr. Carlos Del Rio. Here's what you need to know. People have talked about the coronavirus spreading from different surfaces, your cash, your pet, your phone, and so on. And technically, they're all correct. In fact, the specific surface doesn't really matter. It could spread on almost anything that an infected person gets droplets on. Experts aren't certain how long the coronavirus survives on surfaces yet, but they believe it may last for a few hours, up to several days. This may change depending on the type of surface, the humidity, and the temperature. But here's the thing. You won't get sick from simply touching an infected surface. To get sick, you have to touch the surface, then touch your mouth, nose, or eyes afterward. If you think a surface might be infected, clean it with disinfectant to kill the virus. Also, keep your hands clean by washing with soap and water or using hand sanitizer. Finally, stop touching your face. And yeah, I know it's hard. So at the very least, don't do it unless you've just cleaned your hands.
You're not going to get the virus by touching the surface. Let's suppose I have the virus, and this is the process. I have the virus, I cough, I sneeze, I touch my face with the cough and sneeze to cover it, then I touch the doorknob, and then you come around, you touch the doorknob, and then you touch your face. That's how you get infected. So the 2 points about this is hygiene, personal hygiene, washing your hands, and please don't touch your face because that's how you're going to get infected.
Those steps will go a long way in keeping you healthy and safe. Don't worry about what surfaces may transmit the virus. Instead, focus on keeping your hands clean and away from your face to protect yourself from all infectious surfaces.
There you go.
We forget these things, right? And it's so true. We showed a little bit of video there of leaders at news conferences, in some cases, touching their face. We have to just retrain our brains in some ways.
Yeah, it's true. They're hard habits to break, though. I mean, we're all human, and even though we know that this pandemic is going on, it's just starting new habits and reminding each other that we've got to be safe first.
Reminding each other, that's a good one.